Dr. Lee Childers is a senior scientist for the DoD VA Extremity Trauma and Amputation Center of Excellence at the Center for the Intrepid here in San Antonio, Texas. Along with holding multiple degrees to include a bachelor's in mechanical engineering technology, a master's in prosthetics and orthotics, and a PhD in applied physiology, Dr. Childers is also a certified prosthetist. Now, please enjoy Dr. Childers' presentation on the Center for the Intrepid.
Good morning, everyone. Thank you so much for having me come speak today at the CERT Symposium. My name is Dr. Lee Childers. I represent the DoD VA Extremity Trauma and Amputation Center of Excellence. We are a center of excellence that conducts research to mitigate the effects of extremity trauma, and we embed research personnel at many of the military treatment facilities. I get the privilege of leading the research cell here at the Center for the Intrepid. And in this presentation, I'm going to talk to you about a lot of the great research that's been going on here and a little bit about the building itself. If any time you'd like to know more about this information, you'll see my email address will be at the bottom corner of every slide. You're welcome to email me. If it's a research project that I'm engaged with, I'd be happy to answer you, or I can refer you to someone else that is conducting that research. And so without further ado, I'm just going to get started here. Of course, we have the standard disclaimer that these words are not necessarily those of the DoD, they are my own. And we're going to get right to it. So this is the building, this is the Center for the Intrepid. So this was built by the Fisher Foundation from several small donations across the citizens of the United States of America to build a building to facilitate the rehabilitation of those that were experiencing limb trauma in the Iraq and Afghanistan conflicts. When the building was built, it was gifted to the U.S. Army, and the U.S. Army has been operating it ever since. It has a variety of services, which we'll go into a little bit more, and then also has a large research component. In fact, about half the first floor is dedicated to research. So we're going to talk a lot about the research lab, and a lot of the research projects that will be going on here at the Center for the Intrepid. At the end of the day, our mission is to stay centered at the patient. Traditionally, we've been focused very much on amputation limb salvage, and this picture represents that, someone that is going through both aspects. With the downturn of the conflicts in Iraq and Afghanistan, we're now focusing not just on those amputation limb salvage, but how do we best facilitate operational readiness? Whether this is looking forward to potential prolonged field care scenarios, how do we get our operators back operating with after they've experienced chronic illness? How do we mitigate the effects of tibial stress fracture? Those are now key things that we're trying to do to facilitate not only what the service member needs, but what the larger DoD is asking of us. Regardless of whether or not we're treating people with amputation, limb salvage, or someone with tibial stress fracture, our mission remains the same. And that's to deliver advanced rehabilitation care via interdisciplinary teams. And I want to emphasize the interdisciplinary nature of what we try to accomplish here at the Center for the Intrepid, to conduct research that will optimize the individual function and enable medical readiness. And we want to be the best place in the DoD to do that. And we accomplish this mission through a variety of different services. We have orthopedic surgery, occupational therapy, physical therapy, prosthetic orthotics, behavioral health, rec therapy, nutrition, pain management, and last, what we're going to focus on today is the research component. What do we need to be looking at now to develop the treatments of the future for our patients? And there's several people actively conducting research in this building. I have the privilege of leading the East team here as the senior scientist. And a lot of our work is focused on exoskeletons for prolonged field care, maximizing the residual limb health. How do we keep that tissue as healthy as possible in the prosthetic socket? And evaluating different prosthetic orthotic devices or treatments that may enable better function. And we're going to go through a lot of these in more detail later. The director of our Military Performance Laboratory, Dr. Reggie O'Hara, is leading a program for Special Operations Performance Recovery Program, or SPAR is what we call that program. Again, we'll have more detail on that later. I want to also emphasize it's not just researchers that are conducting research here at the Center for the Intrepid. There's a lot of clinicians and physicians that are also conducting research here. And so I want to highlight Dr. Jeff Teedy. He's the director of the Center for the Intrepid now. And he is very focused in trying to find advanced treatments for pain for our patient population. And then also Doctors Powell and Lofsgarden are part of the musculoskeletal injury musculoskeletal injury rehabilitation research for operational readiness, or MIRROR program, where they're looking at various musculoskeletal injuries and how we best treat those. And then Dr. Louis Sussman with the functional restoration program for those that are experiencing chronic pain. And again, if there are particular topics here that are key interest to you, you're welcome to contact me and I'll be happy to put you in touch with each of these. We don't have enough time to go through everything in detail, so I'm just trying to hit the high points today. Regardless of what we're trying to focus on, is what kind of research program we are working on, we're always focused on how do we best serve the service member. You know, whether that person has an amputation, whether they're been injured on the battlefield and now stuck in a prolonged field care scenario, or they're trying to return to their unit after a tibial stress fracture or other musculoskeletal injuries. You know, we're all focused on the same thing. How do we best serve those that serve us? And I always want us to remember that and be focused on that as we go through this presentation. Because when we get done with our research, we want to translate it immediately to help those that are receiving care here, or those that may need to receive care here from the battlefield. A lot of the research we conduct occurs right here where I'm speaking to you today in the Military Performance Laboratory. This is the laboratory where we focus on studying human movement. We have an instrument staircase, as you can see here in the picture. And so we can put markers on the individual that can be tracked by that camera system that you see in the background. Or in this slide, you can see the rest of the laboratory, a large open space, walkways, where we can evaluate people's motion. And from that, we can track their joint angles, we can calculate their joint moments, how much power a joint's putting out, how much power a particular prosthetic leg is putting out. And we can make decisions and evaluate better treatments from that information. We also have different ways we can destabilize someone. What's under a series of gray panels, which you can see in the inset photo there, is a rock pit that is essentially railroad ballast that as people walk over, they can be destabilized, or they can walk over the uneven terrain there, or even that green instrumented treadmill, which I'm actually standing beside me right now, has stepper motors on there. We can rapidly accelerate or decelerate the belts to simulate tripping and slipping. When we move from this laboratory, we can go to a more closer to reality environment, a virtual environment that we have in our Karen system. And so this is a 320 degrees dome of which a world is projected on that we program. And this person walks on a platform. That platform can move in 6 degrees of freedom. So if it looks like the person's walking up a hill in the scenario, they can physically be walking up an incline on the platform, and it can change very drastically. So they can walk cross slopes, they can walk downhill, they can move on them. We can project a scenery like looks like the ocean, and the platform can move and make them feel like they're on the ocean. We use this a lot in our return to duty assessments, which we'll talk a little bit more about here in a second. And this is a picture of one of those assessments where someone's walking as a dismounted patrol through the Peshawar Valley in Afghanistan. A newest part of our laboratory, and it's a space that's still being developed, is our exoskeleton development laboratory. People just moved into this about 2 weeks ago, and this is where we'll be conducting a lot of the development for exoskeleton projects, again, that I'll talk a little bit more about here in the future. Regardless, again, of what our research particular project is, our primary mission for this laboratory is to conduct research to enable readiness through a focus on returning the patient to high function. So that's a key part here, and we do that through advanced prosthetic devices, exoskeletons, the SPAR program, evaluating them for return duty, etc. And so a lot of what the Center for the Intrepid is, and a lot of what our research lab has done in the past, is helping to develop what's called the Intrepid dynamic exoskeletal orthosis. And that's what you see pictured here in the bottom left. And so this has been a real game-changing technology. So this is for someone that hasn't lost their leg, but may be going through limb salvage operations. And so the limb may not be as functional as what it used to be. And so this orthosis is very dynamic. It has that posterior spring you see on the back can deform, store energy, and return it later on in gait. It actually enables people to return to run. And in the Army, if you can return to run, a lot of times you return to duty. And so this has really been game-changing. It's prevented a lot of people from having an amputation early on. It's enabled people to return to duty, return to their careers, get their last remaining years in, and then be able to retire out or stay on duty. We have several operators using this technology right now out there in the field. Also, another way we've been able to enable return to duty is with our readiness evaluation during dismounted operations. So this goes back to the Karen system. This is the work done by the now late Dr. Christopher Bago, and it's been carried on by Dr. Riley Sheehan here in the lab. And this is where we've recreated the Pashwan Valley in Afghanistan. And someone goes through that as if they're on a dismounted patrol. They have a weapon that is instrumented. They are ambushed. There are targets they must hit accurately and respond to those scenarios. And so we use this as a way to see how well someone might be functioning with a prostheses or an IDEO that may help in some of these return to duty decisions. And this is also an evaluation we continue on today with the SPAR program using our adaptive socket program, which we'll talk about here in a minute, and other operations. So we mentioned the SPAR program several times before. This is being run by Dr. Reggie O'Hara. And so this is a scenario where we're bringing in operators right now from the Ranger Regiment, but now we're getting folks from MARSOC involved with this. They come for 4 weeks to get focused care, interdisciplinary care on whatever chronic musculoskeletal injuries they may have been receiving during the course of their careers. And this is a very focused effort at trying to enhance the recovery, physical performance, and mental resiliency. It's been extraordinarily successful, and it continues to expand. Again, if you have any questions about this program, you're welcome to reach out to me, and I can put you in touch with Dr. Reggie O'Hara. Going back to the kind of combination of several of our initiatives of enabling high function, enabling return to duty, while also maximizing them health, we're now evaluating these adaptive prosthetic sockets. And this is something I mentioned 2 years ago when I last talked to this presentation, and now it's here, and now it's reality. And so this is a collaboration with the University of Washington, Dr. Joan Sanders there, that noticed that, residual limbs, they change shape throughout the day, yet the socket does not change shape. And when you have a mismatch between the shape of the residual limb and the socket, you have poor fit. Poor fit leads to skin breakdown, and that leads to blisters on the limb, and leads to people not being able to use their prostheses. And so she's developed these adaptive sockets that change shape and change volume in real time while people are using it. And so we have the privilege of being able to evaluate that for our patients. How well can they be used for these military-specific tasks? We're using the Red Op scenario for that, as well as other tasks that are used for military service, the buddy drag, dropping to prone firing positions, raising from prone firing positions, crawling, etc., clearing a staircase, and this also been very successful. And what we hope to understand is, do we need these microprocessor scenarios to enable better return to duty, or can we just have it to where the user adjusts it manually, or is the simple solution still the best solution, the static solution? So this is something we have just starting up now. We've had the first couple of people go through, and we're very excited about this project. Beneath the prosthetic socket, we still have the prosthetic foot, and there still isn't a lot of known about what may provide the best prosthetic foot for one person versus another person. And so we have our prosthetic emulator project. And so this is a collaboration we have with the VA. It's being led by the Seattle VA by David Morgenroth, and also involves Amy Hansen at the Minneapolis VA. And what we have here is a robotic prosthetic foot that we can program to mimic the properties of any prosthetic foot we can think of. And this allows us to give people the chance to test drive different prosthetic feet. So currently finding the best prosthetic foot for someone's very iterative. They try something, they take it out in the real world, they see what works, they see what may be best for them, they come back, they may get another one. And this can go on for months to years. And so we hope to accelerate that with this emulator. So they come in and they can go through a couple scenarios, and they can test drive different feet, find out what's best for them, and get fitted with that. And that's pretty much what the study is also. We do that, we emulate the different feet, they try them out, they take them home, and they come back and we find out, does what they like in the take-home trial match what we took in the laboratory. And so far, it is more often than not. And so we're very excited about this and how we can better help our patients find the prosthetic fit that's best for them and get them back doing the things they love to do as rapidly as possible. Yet we also need to be concerned about, what's come from previous conflict, but what we may be facing in the future. And unfortunately, it looks like future combat scenarios will not necessarily be like the past. It is likely we'll be going to a conflict with a peer or near peer adversary. In these scenarios, we may not have air superiority. And if we lack air superiority, we lack the ability to evacuate people in the way that we've been doing, and in the timely manner we've been able to do it in previous conflicts. And this has led to scenarios called prolonged field care, in which we must enable people to maintain mobility so they themselves don't become a target, and allow for them to provide them care during these scenarios until we can get them evacuated from theater. And where we hope to do this here at the laboratory at the Center for Intrepid is with exoskeleton solutions to help mitigate the effects of extremity fractures in the field. And we have two major projects for this. The first one is what we call field improvised exoskeletons. So this is a project led by myself. It's a collaboration with Southwest Research Institute, BAMC Orthopedics, and the U.S. Army Combat Medic School, where we're trying to figure out, okay, what is available to the medic right now? What can we duct tape together and find a solution and improvise in the field that would be safe for the person to use and ambulate on until they're able to evacuate? And so this, we hope to have this study find short-term solutions so that if we have these conflicts occur earlier, we're better prepared for that, while also looking with the understanding that these may not be best solutions for the field. In the future, we may need a manufactured solution. And so that's led us to our second program, which is the Intrepid Battlefield Exoskeleton. This is in collaboration with the ISR right here on BAMC campus, so Josh Winke. Again, BAMC Orthopedics have been heavily involved with this, as well as the U.S. Army Combat Medic School. And this is to design a durable, packable, one-size-fits-most modular exoskeletal system that can stabilize an open tibia fracture and enable battlefield mobility until that person can come back home. Currently, those designs are a little sensitive, and so thus it still remains in the realm of science fiction. And so this is an episode in a science fiction show called The Expanse, where someone had a tibia fracture and had to use one of these devices. And so what we're going to do is we're going to bring that science fiction to reality, enable our folks that are stuck in these prolonged field care situations a chance to maintain their mobility, stay off the litter, and come home to us to where we can receive care here at BAMC and eventually the Center for the Intrepid. So this is something that's just starting up here and will be going on for the next several years. We have a ton of research projects going on here, and I simply don't have the time to go through each one. So I want to touch on a couple other ones we have going on. Again, any questions you have, you're welcome to reach out to me. Not only are we developing exoskeletons for prolonged field care, we also want to enable operational readiness. So how do we mitigate the effects of tibial stress fracture? So this is kind of our IDEO next generation. And we have a grant that's going on for that right now. Reactive hyperemia is a skin response in the residual limb, and it may be very indicative of how that residual limb may be able to withstand loads and pressures on the residual limb. And so we have another big project going on to how we best evaluate that response after they've had an amputation. Also, IDEO, we think that we've presented many lower limb amputations by using the IDEO, but we don't know the long-term outcomes of that. And so now we're going through a project where we're going out to find the people that were originally fitted with IDEO and find out, are they still doing well? Do they need to come back here and receive additional care? Did they receive an amputation and why? So we can better make decisions for future people that may be needing an IDEO or maybe contemplating amputation. We also have projects going on upper extremity to better understand how we might train people to use prosthetic devices before we even get them using virtual reality. That's very exciting. And also our red-up scenario. We've been having that assessment for a while, and we have a lot of data on that. What is the relationship between people that scored well on that and their ability to actually return to duty? That's being investigated by another researcher here named Dr. Riley Sheehan. So And on top of that, we have several other small projects. Again, I just don't have time to go through it today. And I'm excited about everything we're doing and everyone that's participating in these research. Because again, it's not just us here as the East conducting this research. Dr. Reggie O'Hara is here with a team. We have physicians and clinicians. Our director, Dr. Jeff Teedy, is conducting research. Our physiatrist, Drs. Powell and Lofgarden, Dr. Sussman is conducting research, and several clinicians are doing case studies. And we just continue to try to push that envelope on how we can best provide care for our service members here at the Center for the Intrepid. So I'd also be remiss if I don't mention our standing team of researchers here that continue to help push the envelope. Here's a list of their names. We are growing. Our research programs are growing. We plan to be onboarding several other people this year, particularly on the development side for the exoskeleton project. So I appreciate all their time today. I appreciate the ability to come speak to you and tell you about all the exciting things we have going on here at Center for the Intrepid. Again, my name is Lee Childers. I'm the senior scientist here. You can see my email there at the bottom of the screen, and I'll be happy to take any questions from you or help guide you to other researchers here that may be conducting research that is in your interest. Thank you.